Hello, and welcome back to In the Hot Seat with Emily Diala and Dr. Viviana Coles. I'm Emily, and this is Dr. Coles.
Hi, guys.
And we are so excited that you're joining us again today. So in case you've missed it, be sure to scroll back through our YouTube pages so that you can see what other topics we've discussed. We're breaking this down into different series. Each series covers a different topic, so there's lots there. Be sure to check it out. So today marks the first episode of our new series on sexual dysfunction, or sexual difficulty, as I like to call it, because dysfunction just sounds too pathologizing. Today we're going to talk about female sexual pain. So the umbrella term for that is dyspareunia. It's basically, if you break down the Latin roots, means pain with intercourse. But women can experience pain for a variety of reasons, and we're going to go into some of them today.
Sure. So one of the things that a lot of our female clients will come into the office to address is this concern that they have this unexplained pain upon penetration, after penetration, when there's even sometimes the thought of penetration, there can be this unexplained pain. They'll have already gone, because I know what you're asking, they'll go to the doctor, they'll go to their OBGYN, they'll go to their general practitioner and have asked about, what do you see? What's going on down there that I'm experiencing this pain? Literally looking for the cause. Sometimes there are. Sometimes there are causes. There can be lesions, there can be scar tissue, there can be sometimes a penis that is just a little too big for the vagina. We're all different sizes.
Yeah, like vulvar vestibulitis is more often diagnosed in
some sexually transmitted infections that can cause pain. So sometimes there are physiological causes for these pain. And sometimes you can get help from a sex therapist to help you work through the treatment for that. But oftentimes we're getting people who have come in after having sought the medical assessment, and they have found that there is no physiological cause or reason for this pain. And
or you know, their doctors are telling them things like, well, just have a glass of wine and read Cosmo. That's what I heard one time. And it's actually not the first time I've heard it. So their doctors will be very dismissive and just tell them to relax as if it's just that easy. And thankfully now the treatments for these kinds of pain issues have, come to the forefront and people are learning more. But it used to be like when I first started treating this, on average, people would have to visit 7 different doctors before getting an accurate diagnosis. So, hopefully times are changing, and I think the medical community is paying a lot more attention to the mental health community and understanding the strong mind-body connection. So, thankfully now people are getting more accurate diagnosis, but, we also live in Houston, which has some of the top doctors.
Absolutely.
So, my heart goes out to other areas where they really lack information.
And the information they do get is going to be from the internet, and they may have to jump around all over to try to figure out, is this me? Is this me? And meanwhile, their anxiety is starting to really increase. Their relationships are suffering because of the pain and the inability to really enjoy what is supposed to be normal and natural and easy to do. And that's just not the case. Let's start off with talking about what used to be called vaginismus. And what still, if you look on the internet, is going to be called vaginismus. It's the unexplained, and it doesn't have a cause for it that's physiological. Contraction of the outer third muscle of the vaginal canal. So right towards the opening of your vagina, that little space right here, there's an involuntary contraction of those muscles.
Or like a spasm.
A spasm, exactly. Like a Charlie horse in your vagina. And it's not something that you can control. It's not something that you can wish away. It's not something that when somebody says, hey, just relax, that's what we all have to do upon penetration. It's not something that you can just do. So these women who are experiencing this disorder are really at a loss as to why it feels like it's a brick wall, and their partners
describe it like that.
It's like there's nothing there. It's just a brick wall. And it's super, super painful, and it causes most sexual activity to cease. because there's so much pain and so much anxiety surrounding it.
There are different degrees, though. I mean, for some women, it really is like a clamp and nothing gets through. Other women are able to tolerate some penetration, but it's usually very uncomfortable.
Tolerate. I mean, that's not.
I know it's not a word.
Have to deal with
Exactly. You know, some women are able to use a tampon, but, you know, can't tolerate penetration. Some women want to get this worked out so that they can tolerate a pelvic exam at their gynecologist's office. So, you know, it really is just about figuring out what's motivating them for treatment. Most of the people, I would say, though, that end up in our office are just hoping to enjoy intercourse with their partners. But we get a lot of people who've been unable to consummate their marriage because of this.
Absolutely. Or they're deciding that they want to grow and have a family and want to get pregnant and are realizing now, oh man, we should figure out how to have intercourse.
Exactly.
And it's, you know, it can be really relationship straining and sometimes relationship ending to not have this be addressed and be able to treat them. One of the root causes as a whole that we can attribute to vaginismus is anxiety. Uncontrolled anxiety. It does not always have to do with sexual trauma, but it might. It can be partner specific, not always. It can have been forever in your life. It could have just started a month ago.
But I mean, anxiety is a huge component. I think a large percentage of these clients come from maybe different ethnic backgrounds where sex just is never talked about, or it's something that's wrong. It's like I had a client say one time that sex is really the only thing that you're told not to do, and then suddenly it's okay to do. You're not told don't touch a hot stove, and then suddenly it's okay to touch a hot stove. And, you know, so it's almost like this emotional, spiritual whiplash of like, okay, now it should be fine, but you've been told it's wrong, or to avoid it for your whole life in your body.
Or told it's never, I mean, it's like something you should avoid, like the plague.
Exactly.
I mean, it's really... And then all of a sudden you're right.
And there's lack of education and information about what's normal or what to expect. And so people go into their first sexual experiences with a lot of fear and uncertainty. And, you know, instead of learning to say no or let's go slower with their words, their bodies are saying it for them.
Their bodies are saying it. And what's really relationship, straining is the idea that for a lot of their male partners, they're thinking that it has to do with their feelings about their partner. And it's not typically the case. Sometimes it can be.
Sometimes it
can be. But most of the time, it's that they are feeling very connected to their partner. They do want to do this, but their bodies are saying no. They're answering the question, do you feel ready for this, with a resounding no, and their bodies literally are not going to let it happen. So when we're talking about treatment for what used to be known as vaginismus and now is called the genito-pelvic pain/penetration disorder, one of the things, I know it is a mouthful, we want to make sure that we're addressing anxiety and fear by giving psychoeducation about sexuality. Sometimes women don't know what is happening and what is going on with their pelvic floor.
They don't understand how their bodies work.
They don't understand how their bodies work. And all they know is that maybe they urinate from the area, they defecate from the area, and they might have a menstrual cycle because of whatever, but they don't know exactly what's going on.
They're unable to label their parts, let alone understand how they function. So, I mean, really, we believe that information is power. The more you know, the more empowered you feel. So I think it's super important to start off by providing information and
not just for the individual, but for a couple.
Yes, for the couple.
We will do lots of education with our clients about both female and male genital parts, their reproductive systems, and how everything works, pleasure centers, just to help everyone get a little bit of a recap from what may have either never been discussed or was discussed decades ago. And now we have lots of information out there to really spell it out for them. Once they have a better lay of the land, then we can talk about what are some strategies to make sure that the area is relaxed, that it's ready to receive any sort of penetration. And I often tend to start off with something as small as a dilator that would be like a Q-tip.
Yeah. So usually in the therapy office, we're talking about different relaxation strategies, helping them work through the anxiety. And then typically what we're prescribing them to do at home is called dilator therapy. And there are lots of different companies now that make vaginal dilators. And essentially they're just little devices kind of in the shape of a penis that go from very small and eventually approximate the size of their partner's penis. And it's called graduated dilator therapy because they, gradually get larger and larger.
And you can find these online, but what I've found is that people who try to do this at home, they're not addressing the anxiety and the fear. And then it all shows up when their dilators show up. So I think it's really important. You're going to be doing a lot of this at home, and you can try this at home, and there are books that go with it. But I find that it's going to go a lot quicker, faster, and it's going to be more long-term if you find a sex therapist that can help you walk
work through
it.
Get adequate education, don't rely solely on the internet, and then, of course, address the anxiety. And again, there's a large percentage of clients who do have a history of trauma. Working through that trauma can, set you, up for success.
Absolutely.
And then, in addition, so for about a year, I worked as part of a multidisciplinary team whose sole focus was treating different kinds of pelvic floor disorders. And so, in addition to the therapy and dilator therapy at home, some clients really benefit from working with a physical therapist who specializes in the pelvic floor. So just when you injure your knee and you need to rehab your knee or your shoulder, you work with a physical therapist. The same applies to the pelvic floor. Because truly the pelvic floor is a huge group of muscles. And I find physical therapy to be especially beneficial for, women who maybe have scar tissue and that's creating some kind of restriction for them. It really requires a physical therapist getting in there and, working through the trigger points.
Helping to strengthen those muscles after they've been weakened by one or multiple pregnancies. If there's been some sort of bladder displacement, things like that, certainly as sex therapists, we're not going to be able to help you with that. But fortunately, there are people out there whose sole focus is to help that area of your body and rehab that area. There are lots of other factors that go into pain.
Yes.
And that's something that we've for sure are able to address in therapy. But when it comes to female sexual pain, there's a lot of shame that goes into it. There's a lot of kind of building up and empowering these female clients to know that it's okay that you don't know all of this about your body. You're seeking this information out now. You're going to become the expert of your own genitals and your own vulva, and you'll be able to soon feel you have a much more of a big handle on your life, especially your sex life, regarding the pain and being able to work through that. And it's really interesting to see and super rewarding.
Oh yeah.
Because this is
especially when, if their reason to come in and get treatment is because they want to start a family. And I love those phone calls that are, we're pregnant. So that is very rewarding.
I have yet to have anybody name their baby after me. Come on, somebody out there.
Right? No. Oh, but you know what? Another cause for pain that's very common that we haven't addressed yet is vaginal dryness.
Oh,
so, we can get into that a little bit right now, I think. So, women can experience vaginal dryness for any number of issues. Some women just don't lubricate as much naturally, and that's fine. Using an over-the-counter personal lubricant can do wonders. Do not shy away from it. I always remind people there wouldn't be stores all over the place that sell this stuff floor to ceiling if it was that easy for everybody.
Absolutely.
So sometimes you just need extra help.
And there's some really neat, discreet options for those people who maybe don't want to have to carry it around or know that they're going to be engaging in sex, within the next hour or two. There are little ovules, and then there are small ones. There are the big ones with the pumps. And there's so much. The important part is to find a lube that works for you, that has the consistency that you're looking for. Unfortunately, it's like with everything else, there are lots of options out there.
So many options.
And
we need another episode to go over lube.
Even more importantly, is to find the ones that do not work for you.
Right. I don't usually recommend the warming or tingling.
Yes.
Most of the time I get
flavored,
negative feedback.
Smelly ones. Simple.
Yeah, keep it simple. Yeah.
Simple.
And if all else fails, people love coconut oil, so you can try that. Another reason why women sometimes experience vaginal dryness is because they've gone through menopause. So what happens when you've gone through menopause is your estrogen levels come down, Estrogen is a key hormone that's involved in vaginal lubrication. So as the levels go down, then you don't create as much of your own vaginal lubrication. Over time, the muscles in the vaginal canal can actually atrophy a little bit. So
it can actually end up with at least my clients have told me, is that it can actually feel like they're going to a prepubescent vaginal state.
Well, they do. The vaginal canal shortens quite a bit, and it's kind of like that use it or lose it to a degree. I mean, it can be rehabbed, but if you're going through menopause and you're not, sexually active on a regular basis, you may want to consider getting some dilators just for maintenance, so that when maybe you are sexual with someone, that it's more comfortable for you.
Absolutely. We'd love to hear your thoughts about all of this and what your experiences are. Your experience can help other people to kind of help and get the help that they need.
Yeah.
Please check us out on Twitter, Facebook, and on YouTube, and #HotSeat. We'll see you next time.
Bye, guys.